Okay, let's dive into a term you've probably seen everywhere online: leaky gut syndrome. It gets blamed for, well, pretty much everything, from brain fog to bad skin. So, is it a real medical condition or is it just internet hype? In this explainer, we're going to separate the science from the speculation and give you a clear, no-nonsense plan for your gut health.
So, have you come across this on social media? I bet you have. It's usually pitched as this simple, hidden answer to a ton of health problems. But, the real story behind it is actually way more fascinating.
And you can see why the idea is so popular, right? One single cause for this whole list of really common problems. I mean, proponents link it to everything from digestive upset to feeling tired and foggy all the time. It's a really compelling theory, but let's see what the actual science has to say.
To really get to the bottom of all this, we first need to appreciate the incredible barrier system that's working inside you literally right now. It's not just some simple wall. It's more like a highly intelligent, highly selective gatekeeper.
Think about it like this. Your intestinal lining is basically a super high-tech security checkpoint. Its whole job is to meticulously check IDs. It lets all the good stuff, water, nutrients, pass right into your bloodstream. But it's also designed to keep out the troublemakers, things like toxins, undigested food bits, and bad bacteria.
Now here's the thing, you're probably not going to hear your doctor talking about leaky gut syndrome. The scientific term for this phenomenon is intestinal permeability, and it is a real, measurable thing. It just means that the security checkpoint we were talking about has gotten a little less strict, letting things slip through that really shouldn't be there.
And that security system is actually pretty complex. It's not just one thing, it's a three-layer defense. First up, you've got a layer of mucus that acts as a buffer zone. Then, there's a single layer of cells packed together incredibly tightly. And here's the crucial part. In between those cells are these little protein gates called tight junctions. These are the actual security guards, deciding what gets an all-access pass and what gets kicked to the curb.
Okay, so we know the gut barrier can become more permeable. That's a fact. But here's where the real debate kicks in. Is this leakiness the root cause of other diseases, or is it just a symptom of a disease that's already brewing?
This slide really lays out the two sides of the argument. On the one hand, the wellness theory says that leaky gut is the root cause. It starts on its own, toxins leak out, and that triggers all sorts of problems. But the established medical view, well, it tends to see it the other way around. It suggests that an existing disease, like celiac disease, causes inflammation, and that inflammation then damages the gut lining, making it more permeable as a symptom or a consequence.
And this quote from the Cleveland Clinic just sums up the medical consensus perfectly. They're saying, look, we know intestinal permeability is real, but we don't have the evidence to call it a standalone disease or to say for sure that it's the thing causing other diseases. It's the classic chicken or the egg situation.
So, with all that in mind, what do we actually know can damage this intestinal barrier? It's really important to separate what's medically recognized from what's still just a theory.
Okay, these are the heavy hitters. We have really strong scientific evidence that conditions with a lot of chronic inflammation, like IBD and celiac disease, directly harm the gut lining. Same goes for really aggressive treatments like chemotherapy or the long-term overuse of things we know irritate the gut, like NSAID pain relievers and alcohol.
Now, these are the factors that the leaky gut theory tends to focus on. And look, things like a poor diet, chronic stress, or an imbalanced gut microbiome are definitely not good for you. They can for sure cause some gut inflammation, but their role in causing clinically significant intestinal permeability, well, that's still being researched. Right now, they're seen more as potential contributing factors than direct proven causes.
And here is a really, really key takeaway. Leaky gut syndrome is not an official medical diagnosis. A big reason for that is because there's no standard test your doctor can run to check for it. The tests that do exist are used almost exclusively for research studies.
So, with all this debate, what are you supposed to do? Honestly, the most productive way to look at this is to stop getting hung up on the controversial label and instead focus on what everyone agrees on: the importance of supporting your overall gut health and keeping that barrier strong and intact.
So what does a gut-friendly diet actually look like? Well, the good news is the advice is pretty consistent. You want to focus on whole foods, especially things with plenty of fiber and prebiotics. That's the stuff that feeds your good gut bacteria. Fermented foods and healthy fats are also fantastic. And on the flip side, it's a smart idea to limit the things that can cause inflammation, like a lot of processed foods, added sugar, and too much alcohol.
And it's not just about what you eat. Your lifestyle plays a massive role here. The gut-brain connection is absolutely a real thing. So managing your stress is crucial. And prioritizing sleep, that gives your whole body, including your gut lining, time to repair and regenerate. And of course, regular exercise and staying hydrated are just foundational for your overall health, and that includes your gut.
Okay, this is really important. If your symptoms just won't go away, if you're seeing any red flags like losing weight without trying to, or if your issues are severe enough that they're affecting your daily life, it's time to see a doctor. Trying to self-diagnose with leaky gut can be risky because you might miss a serious underlying condition that really needs proper medical treatment.
So, let's wrap up with a new way of thinking about this. What if, instead of worrying about fixing a leak, we focused on building a truly resilient gut? By making smart choices every single day, you can create a strong internal ecosystem that becomes its own best defense. Now that is a goal we can all get behind.